Now you're going to start doing it. So hi, everybody. I am Angela from Nutmeg Moms Toronto, Nutmeg Consulting, and the Birth, Babies, and Breastfeeding Virtual Academy for online courses. So we are doing a repeat, yay, because we had some technical difficulties. So this is Aliza Shupac, the P, not a B. And we did a session before for Nutmeg Moms, and I really think it was one of the best sessions we've ever done. It was just so, I just thought it was really great. And I messed up with the recording. So I really just wanted to see if we could do it again, just so you could, help lay things out, kind of talking about the transition to motherhood and postpartum mood disorders. Yeah. Or just issues in general. And so thank you. Thank you for coming and doing it again. Thank you. So yeah, maybe if you wanted to just tell everyone a bit about it yourself, and yeah, go for it. We'll have a little chat.
Okay, great. Okay, so hi everyone out there. I'm very excited to be back. My name's Aliza Shupac. I'm a licensed social worker and psychotherapist. I've been in practice for over 10 years, working with couples and families and children, doing a lot of parenting work, supporting individuals through depression and anxiety. And then a few years ago, I went through what I like to refer to as my own messy journey into motherhood, which is...
Aren't they all?
Aren't they all? Exactly. Aren't they all? And I was really blown away by it. And particularly as a mental health provider, I was shocked that I was still so unequipped for that experience. And that, I think, like so many of us in this field, really set me on a course to wanting to help other mothers and new parents to get the support that I was looking for, but felt like I did not get with my first child. And so I set out to do additional training, and I established MamaCare, which is a mental health support for mothers and for couples who are struggling in the perinatal period. So when your pregnancy, during pregnancy, and then well beyond. I first started actually supporting women in the postpartum period, and it's kind of expanded through that. So I'll work with, individuals and couples in that time. And then as people go on through their parenting journey, continuing to offer that support. And I'll talk a little bit more about that piece later, like that therapy piece later. But I want to first just kind of talk about the transition into motherhood in the first place. And then, like Angela said, I'm going to talk about perinatal mood and anxiety disorders. So I want to start by talking about a reproductive psychologist named Dr. Alexandra Sachs, who is practicing in the US, and she was seeing woman after woman coming into her office saying to her, I think I have postpartum depression. She'd listen to them, she'd listen to their symptoms, and then she'd say, I hear you, that sounds really tough. I hear you're going through a lot, but you don't have postpartum depression. Like, you don't meet criteria for postpartum depression. And so after seeing so many of these women for years, she realized, like, we don't have a name, we don't have a word, and we don't properly tell and equip women and everyone in our society just what the postpartum experience is like. And so she started digging through the research to see if someone had come up with a term for this period of life. And she didn't find anything in the medical literature, but she did find something in anthropology. So an anthropologist, a female anthropologist in the 60s or 70s, had come up and coined a term called matrescence, which, if anyone hears, right, it sounds really similar to another period in our life, another big transition.
I have two of them in my house. Adolescence.
Yes. So we kind of know about teenagers, right? Like when we see teenagers behaving a certain way, there's sort of this like societal acceptance and understanding. I mean, obviously when you're living with them, it's super challenging, but there is kind of this understanding that, like, it's this real period of kind of temporary madness in a lot of ways. Yeah. And, the hormones, it's a time of huge hormonal change. It's a time of huge relational change. It's a time of a huge change in how we view ourselves. And that happens again when we become moms and we don't talk about it. We don't adequately prepare moms and women for this. And it's so, there's such a power in naming it.
Yeah.
Because when we name it, right?
It's real. Yeah.
Yeah, it's real. Exactly. It's real. And I see so many women in my practice who are struggling with a lot of shame because they are holding themselves up to these expectations, these myths of motherhood that are just not true. They're just not in accordance with reality. So I'm so happy that you asked me to be here, because I love having these really, honest and real conversations about the messiness that involves the transition to motherhood, the change in relationships that happen with our partner, with all of our family members, and often, the tension that happens, and then the change and the tension that happens within ourselves as we figure out what our new role is, while these, while our hormones are going mad at the same time, and we're probably more sleep deprived than we've ever been in our whole lives.
Totally.
Yeah. And Angela, I'm sure you see this, like you're kind of coming in with moms.
Oh, I see the matrescence every time. I should just, and it's true, like people think that they're supposed to be able to know, like they're supposed to know how to do everything. I mean, obviously I'm usually helping with breastfeeding or baby care or something, but they feel like they're supposed to know all these tasks and all these skills, but also meanwhile, they're learning, what do I even feel about what I'm trying to do? Do I care? I don't know. It's just so much. And then also dealing with a partner who may try, be trying to help, but not know either, or not trying to help, or it's just, you're so right.
It's so messy.
A lot. And yeah, it's not just another part of being a woman. It's just, or a birthing, I don't know. Yeah.
No, it's so new. It's something so new. And and right. Like you really get to see just how normal
everyone.
Yes, for this upheaval to be happening. And just full disclosure, that is how I met Angela. Like she walked into my upheaval. And was such a amazing, wonderful, and supportive presence during that.
But don't worry, I do not remember your particular upheaval. It was long enough ago. I don't remember, I swear.
Yes.
They apologize. Literally, I go, right now I'm just doing virtual, but they apologize like, oh, I'm sorry, the house looks a mess. Like, are you kidding? Like, I have had 3 children. Trust me, this is like, the fact that you're up standing is magical. Like, we feel like we're supposed to have it all together, and no.
So some of the most common myths of motherhood that I see, that I come across is, one, this idea that it's going to come naturally to us. Like you're going to have this baby and then you're going to just know what to do with it.
Yeah.
Another really big one, this is probably the biggest one that I see, is I should love this. I encounter so many moms that really struggle and like hate so many parts of the postpartum experience and have so much shame around this, because we're just sold this bill of goods, right, that we're going to love every moment of this. So just kind of breaking down these myths, right, like these are myths, it only looks this way on Instagram and in diaper commercials, and not in reality.
And then they have guilt too, that is not what they're feeling. They feel so bad that they don't love it, and especially if they've been trying really hard to have a baby. People say that to me. They say, it doesn't mean you have to love all of it. Like everyone has a moment where they're thinking like, why did I do this? But it doesn't mean you don't love the baby. You're still going to take care, it's just part of it. Yeah.
It's just part of it, is really hating so many parts of it. And
more in general.
And that continues. But
it's much better. Sorry, it gets better.
It gets better. It does. I shouldn't need other people's help is another big one. I should be able to do this alone. Another thing that women feel so much shame, can feel shame around, right? Because again, we're kind of told in our society that this is something that we should be able to handle. This is like a one-person job to take care of a baby. And that is not true. Like for most of human history, women were not doing this alone. We were doing this with the support of not just one other person, but like a whole
village,
community, a whole village of people. And that's really not there. And we've really internalized this idea that we should be able to do it by ourselves. And then conversely, there's this other myth of kind of like the perfect partner, right? So my partner should know what to do to support me. Right.
Yeah. Well, if we don't know, why would they know? It's true. Yeah, it's hard.
This one's less common and it's a little bit more subtle, but it kind of sneaks up and I know I have this one a lot, right? Where I just
tell that that's what I need.
Well, I just wanted my husband to know that I needed endless amounts of water throughout the house. But it's like partners are also struggling with their own sort of myths of making sense of the same thing, like the myths of fatherhood and the myths of motherhood and their own transition into parenthood. And this is where I find for couples to even do 1 or 2 kind of joint therapy sessions can be so powerful. It can be such a helpful time because we know that it's so common for couples to run into marital distress during the first year postpartum because, again, going back to this matrescence idea, right? Like having a baby just causes such an internal shift for the woman, for sure, often for the man, but certainly for the woman in terms of, our female's internal functioning. And also really just changes the nature of the relationship between the two people. So just getting that external support, even for 1 or 2 sessions, can be really helpful for a lot of couples to just kind of help them understand each other and the journey that each person is on, and then figure out how to kind of communicate and support each other as a unit moving forward.
For sure. I know a lot of same-sex couples will have a hard time also because the birthing partner, people think, oh, well, they know everything, but they think if it's a female partner, well, you must know everything because you're a woman too, and it's so unfair. It's the same thing. Like, how would you don't know? Nobody knows what they're doing. So
there's another kind of set of myths that come up.
Yeah,
and we kind of confront those myths as they're happening, like as we're experiencing it.
I didn't even realize it. Yeah.
So when we think about what we can do about these myths, right? I mean, the first thing is having these sort of radically honest conversations in these kinds of groups with each other, just really breaking down the shoulds in terms of with ourselves, really practicing self-compassion. And sometimes just asking yourself, like, what advice or what would I say to a friend who is going through this right now?
I love that. Yeah.
Because we're so much tougher on ourselves than we are to anybody else in our lives. I mean, maybe other than our mother-in-law, which we could probably do a whole separate conversation just on that. But, generally speaking, it's so much easier for us to find that compassion for other people in our lives than for ourselves. So really just practicing that self-compassion through that question can be so powerful. Giving ourselves permission to feel whatever it is that we're feeling, reminding ourselves that this is normal, that this is a hard and messy experience, and no woman has it like together, whatever that means. Bringing our wise mind into it, like asking we all have this sort of wise part of ourselves, this wise mind that kind of watches the fluctuations of our mind and of the experiences around us, that knows that this is going to pass, and kind of calling up. And this is really from mindfulness. So kind of cultivating some kind of mindfulness practice, but through reminding ourselves and asking ourselves, like, what would my wise mind say? And reminding ourselves that this too shall pass. This moment is going to pass. I know that that's a very powerful phrase for a lot of parents in the postpartum period. And then a super tough one for a lot of people is asking really directly for what you need. And I think this can be a really tough one for women in general because, often in our society, we're kind of raised to be the helpers, the supporters, the fixers, and we're still kind of working against that idea that it's okay for us to ask and direct and really communicate in a really direct way for what we need from others. And to be able to do that, we also need to be able to kind of sit and reflect first with ourselves, like ask ourselves, okay, what is it that I actually need from people?
Yeah.
And I can remember in my, especially with my first child, like really being so overwhelmed and not really knowing what I needed from other people. So that could be a sort of self-reflection process on its own to figure out what is it that would be helpful for me, and finding the people, kind of speaking to other people's strengths. Like if you know your mom is going to be really good at making you food, can you asking that, or a friend, right? Asking another friend to come do your laundry. And with your partner, figuring out in a really clear way what it is that you need from your partner. And these are sort of for the tangibles and the intangibles, like the hugs. Like, I just need you to listen, not give advice, just listen. And the last piece of advice I have around this is really getting in touch with your mama bear. And I find that women, we don't necessarily have intuition on like how to get our baby to sleep.
No. I'll teach you that.
I mean, I'm just speaking from personal experience. I did not find that to be as intuitive as I had thought that would be.
They're like, you put it down. I'm like, no, you don't.
No. You're like, hold it. Okay, you're going to be doing that for your whole life. Right.
Yeah, it feels like it. I swear it's not. Yeah.
But we all do have this real intuition of like protection, this idea of sort of protection of the baby and how to bond with our baby. And sometimes there's stuff interfering with that voice, but it's there somewhere. So really giving yourself permission to kind of access that mama bear. And if there are other people in your life who are trying to interfere and make decisions for you and for your baby, to really give yourself permission to go, no, I'm going to communicate this in a way that is loving and compassionate, but like, I'm the mom and I get to call the shots, and that's totally fine. That's what needs to happen right now, because mom and baby and that unit together are the most important unit in this.
Nurture it. It's so true, because people really don't, because of the internet a lot, people don't trust their own instinct. They really are always looking to everything else. Like, what should or me, like I get a lot of texts, which is fine. But I'm like, well, what do you think? And people don't realize like, oh, I did actually try this and it worked. Well, that's amazing. But they haven't kind of, they haven't built that trust in their own instinct. Like you may not know exactly what, but you have an idea that it's not right. Or, like, oh, I don't know. I didn't like when they said that. I didn't really agree.
Yes.
Have something. So I totally love that. Like, you have to start building your instinct.
Totally.
Because you're going to need it the whole time.
Totally. I'm actually remembering now when in this original discussion that that one of the examples that had come up was a co-sleeping.
Oh, yeah. Bed sharing and stuff. People, It's
right. Because you'll get, like, I remember my pediatrician was like, don't don't do it. And it felt so right for me, just kind of instinctively.
And so people don't realize, like, well, then go over here. And I don't try to convince people to do it, but I say, oh, did you know there's safe bed sharing information? And the research over here shows that if you do this and this, it's very safe. And they're like, I had no idea, because we were told the opposite. Yeah. So if you have that feeling to like nurture that and go looking, that's a great point. Go look for the advice that supports what you're thinking. And if it's really wrong, fine, then you'll find all the research says not to. Fine, but like something like that,
don't wash it, right? Like,
does it? There must be some
input.
Yeah.
Yeah, like don't discount, even though this might be your first baby and you've never been around babies before, you don't need to discount that real sort of mama bear instinctive
just one person saying it. You're right. That's actually really true.
Yeah. Yeah. And the other one, which kind of segues into the next piece of what I want to talk about, my other example for this was like, I was so insistent that anyone that held my babies, and this was pre-COVID, but anyone that held my babies was going to wash their hands like well with soap and water before they touch my babies. And I got so much, I got so much flack for it from certain family members. And I was like, okay, this is awkward. I'd have some awkward conversations of like, oh, can you just wash your hands before, but it was really giving myself permission to say, I'm the mama bear. I get to make the choice of how to protect my child. And it was a process of kind of finding that voice and learning how to speak up and advocating in that way and just honoring that. So I hope that this resonates with with other mothers out there who are kind of struggling with that.
And it can feel hard. I hear that a lot. And I actually just gave that advice the other day. And I said, oh, I was just over the top with anything when people were, telling me the opposite of what I was doing. Oh, yeah. I just love this, or I'll go over the top about how much I loved holding my baby all day or whatever. But it's sometimes just saying, isn't it great that you got to raise your baby the way you wanted, and now I have to make the choices. I know I've learned I have to be the one to make the choices for this baby.
Oh, that's
and
good.
It might be totally different, like almost as a joke, but making a point of saying, yeah, you got your chance with your kid. It's my turn now.
This is mine.
Mine, yeah.
I'm Mama Bear.
I
love that way of dealing with it, because it can be so hard to figure out how to communicate.
How to say, yeah.
Yeah.
Love it.
Well, so the hand washing example, I think, kind of segues nicely for us into talking about postpartum mood and anxiety disorders. Because it's like, how do we know if that kind of vigilance around hand washing is an anxiety disorder, or is this kind of just part of the normal postpartum experience, right? And let's kind of get into that a little bit more. So I'm going to be using the term PMADS, which is an acronym for postpartum mood and anxiety disorder. And I think a lot of us know there's a lot of talk, which is wonderful, about postpartum depression. That's probably the one that's most familiar for people, but there's sort of a whole host of other disorders that fall under this umbrella term of postpartum mood and anxiety disorders. So before we talk about what those PMADs are, let's just quickly talk about what it's not, which is the baby blues. And the baby blues is a 2-week, happens in the first 2 weeks, if it happens at all. It happens for some women. 2 weeks after a baby is born, and it usually kind of feels like really crying really easily, feeling keyed up, agitated, overwhelmed, and it clears up on its own within the first 2 weeks. And it's most likely caused by just the very intense hormonal fluctuations that happen after a week of birth.
For sure.
And we know it's not baby blues already if we're past the 2-week mark. So other types of postpartum mood and anxiety disorders can be diagnosed and can show up anytime during pregnancy and anytime in the first year postpartum. There's some debate of whether or not they could show up even later than the first year, but right now, the sort of medical psychological community has defined it as the first year postpartum. So the first one that we're going to talk about is postpartum depression, which again is the most common one. But even with that one, even with all our awareness of it, it can be hard to catch because it can sometimes show up as anxiety. Like, it's often referred to as an agitated form of depression, other than how it shows up in other periods of time in our life. So again, it might be the anxiety that people are most aware of, like feeling keyed up, feeling agitated. But one of the hallmarks of it is a sense of helplessness and hopelessness. Right? Like, things that used to bring you pleasure no longer do. You're not feeling pleasure in your experience with the baby at all. Like, again, having moments of those, totally normal, but like at all. And this overwhelming sense of helplessness and hopelessness. These markers are also harder to catch because impaired eating and impaired sleeping. But like, what new mom does not have impaired eating and sleeping, right? Yeah. But the idea is, like, when you have an opportunity to eat, if you have no interest in food, or when you have an ability to sleep, like you cannot sleep at all. And we diagnose it when it's happened for at least 2 weeks. It has to have been going on for 2 weeks or more. And it needs to be impairing functioning. So, it's really impacting you on a very regular basis, and it's changing your activities and the kinds of things that you do. And sometimes postpartum depression also shows up as anger. It can kind of hide itself behind anger. So women will describe, kind of flying off the handle really easily at their partner or at their loved ones. And another one of the features that can be present with postpartum depression is what is non-clinically referred to as scary thoughts.
Mm.
And scary thoughts are really common in motherhood. And they do not necessarily mean that a woman has a diagnosable mental health disorder. They're really common, even, just within the sort of normal or typical postpartum experience. But it's this sort of either a thought or a really vivid image of harm coming to your baby. And that harm could be something that happens sort of by accident or harm that you are inflicting on a child. So like a really common one is, families where there are stairs, like imagining themselves.
I'm literally thinking that. I was like, I had that one time 15 years ago, 3 days after my baby was born, and I was carrying her past the stairs, and I thought, oh no, she could go. And the whole thing, and I just held her tighter and walked quicker out of the way, and I was like, what was that? And I never had it again, but there you go. You totally reminded me. Yeah.
I also had it with stairs too.
Yeah, I was like, oh, I just saw that's not good. Yeah.
Yeah. So
you think a little bit like, oh no, am I gonna have PPD? Am I gonna have PPD? And then it went away. So then you're okay, and you maybe don't need further help. But
yeah. And I think often, again, like that's why I really like to bring it up, because just, again, naming it, normalizing it, like the fact that you're having a scary thought does not mean
now you're yeah. Because I think that's what people think, like, oh, I'm crying. And I usually mention the crying, people cry usually day 3 or 4 in my experience. Yes. So I always say, oh, don't worry. I said that this morning to someone, you're going to cry all day today and tomorrow. And she's like, oh, good. I already was. I thought I was like losing it. Like, nope. But people need to know what's normal.
It's such a relief, right? It's such a relief. Yeah. It's normal. I mean, I've worked with women who won't carry their babies down the stairs.
Yeah.
And so that's where we see like, okay, we need intervention.
It's a little bit too, yeah.
Yeah.
It's interfering. That's interfering with your life.
That is interfering. Okay. Exactly. Like I can't hold the baby down the stairs. It has to be someone else, or really getting really anxious when other people do it. So just kind of knowing that that's normal, and then that when you're feeling distress around it, it means the likelihood of it happening is actually a lot less.
Yeah.
But the reason why this is so normal, why the scary thoughts are so normal, is because all new mothers have some increase in anxiety, and often the non-birth partner also experiences an increase in anxiety too. I think, I know there was a study that showed it was like up to 30% increase in anxiety. Oh, wow. Totally normal without, necessarily meeting criteria for postpartum depression or anxiety. It's just, it's part of the experience. Yeah. And not only, it's part of the experience for a reason, right?
Yeah, it's protective.
Yeah,
that's actually smart. Yeah.
Like
it's a new job. It's a new job, a new person to take care of. You're learning a lot, and it's good to worry a little bit to protect your baby.
You have to. It's adaptive. Like there is a level to which it's adaptive. That meaning it helps us, it protects us, it's there for a reason. We need to have the thought of like, oh, I could drop my baby down the stairs.
So I'll be careful. Do this, or hold on to the railing, or I got runners on all my stairs within like a month.
Yeah, me too.
Like,
yeah, so it's like that's where it's adaptive. So you say like, what's within my control? What can I do about this? Right, and then you go do the thing. Like that was my
never wear socks. Yeah.
And I didn't wear socks. Yeah. But then, like, let's say you get a runner and you're standing with your socks, and you're still like, I can't bring this baby down the stairs, right? Where you can't shake that thought. Well, that's right. That's where we probably want to really get.
You can't control it at that point. It is something else that's kind of taking over. Okay.
Yeah. That's where it goes from being adaptive to maladaptive, right? To being helpful to no longer helpful, because it's impairing your functioning, and it's taking you out of the experience of being there with your baby because you're so preoccupied with worrying. And again, this is something that can also happen for the non-birth partner too. And even when, got
a lot of bright light there.
Oh, it just timed out. Back to meeting. Sorry, 1 second. We're back.
It's okay. You're still here.
Okay.
I have a paid subscription to Zoom, so you should
good.
forever.
Wow. Yeah, you're gonna have to stop me because it's so
Oh
easy
no,
for me to like go on about
this
this.
is great. Well, I did it before, so.
Yeah, second time around. So yeah, so for anxiety, the scary thoughts are also a really big feature. And it also really interferes with sleep and with eating, but a common complaint is, the baby's sleeping and I still can't sleep.
Yeah.
Because I'm stuck worrying, right? Or another really common one, you've probably seen this a lot too, Angela, is checking. I need to go check on my baby.
Yeah. And you're supposed to do that for a few days. Like everyone, I think, does it the first night or two, but then you kind of have to trust at some point, and you've done all the things to be careful. Yeah.
Yeah.
And even I see it like 6 months later or whatever, like every little thing. And I think the internet doesn't help, to be honest, with the anxiety. I see it much more in the last 10 years, just even the last 5 years. I always just see anxiety because people are checking every single thing on the internet, thinking I have to find the right way, or I have to double check that my way is really the right way, but then they get 15 other ways, so it just makes them worry more, kind of. I feel like it adds to it, but
it feeds into it.
At some point you have to kind of like, oh, let's just watch and see what happens. I don't know, it's really hard though.
It's really hard, and the internet definitely adds a whole other level to it. The good news though is that whether or not, someone's experiencing these symptoms, and whether or not it's to the point where they meet criteria for a postpartum mood or anxiety disorder, we know that therapy helps.
Yeah.
We know that interventions really help. Cognitive behavioral therapy has been shown to be really helpful. So which is where we help people kind of look at their thoughts, like step back, kind of zoom the lens out, look at the kind of thoughts that are coming up, and examine the evidence a little bit more. Mindfulness practices can really help, helping people learn how to manage their sort of fight, flight, and freeze response, which is where mindfulness can really come in to play. Breathing exercises are really helpful, and also just having a safe place to be able to explore and have these conversations, and maybe help with some of the complex like family dynamics that might be coming up that tend to be things that can exacerbate a woman's experience during the postpartum period. And I also want to say about PMADs, right? Postpartum mood and anxiety disorders, that they are so common. 1 in 5 women suffer from them. So I don't know, maybe you know this, Angela, but I know like gestational diabetes. Every single woman is screened for gestational diabetes. I don't know what the stats are, but I know that the likelihood of having gestational diabetes are so much less than the chance of having a mood or anxiety disorder during the perinatal period. And we don't screen for it.
Yeah. I feel like some people say, oh, at my 6-week checkup, my doctor asked me like 5 questions or 2 questions or 1 question. How are you doing? Like, you're probably going to say, oh, I'm okay, or I'm tired. Like, I don't know. It depends on obviously your relationship with them, but it needs to be like a full screening.
Yeah. Which is what the current recommendations are, but I don't see it happening.
Yeah. And I mean, it's good if people, not that you should have to, but if people, I have partners sometimes asking for help. Like, I think maybe something's happening, and I can send them like, here's the screening tool. I don't know. Not that they should be doing that, but just so they know.
Well, I think
people are doing it for themselves now, which is great, as long as they know what's, when you need a bit more help.
Yeah, so I think the screening tools are great in that they really raise awareness for people to say, oh, okay, maybe I don't need to be experiencing this, or to the extent that I am. It's kind of like it flags it for us. And also, just knowing that you don't need to meet criteria for anything to benefit from support. I think in a perfect world, all new parents would be given support, would be given, a few sessions of therapy.
I think that's so true I always say pelvic floor physiotherapy for a new parent, birthing parent. And like really, and people think, oh, therapy. Yeah, but it's just like working through what just happened. Yeah. Working through your feelings about what just happened. Working through anything, if it is a bit of a struggle or more of a struggle than you think. it's like, and the relationship piece, I think that's really important. People feel like they've done something wrong, that they're, you know, not getting along right now, but it's hard enough. Yeah.
I remember, I think we talked about this last time too, that a good friend of mine shared her last piece of advice to me, like before I gave birth, was, you know, just whatever you do, like don't decide to get a divorce in your first year postpartum. And I remember like coming back to that thought in the first year postpartum. It's just so normal to experience like real conflict with your partner, even where, you know, you could have been with them for years and not have experienced this, because it just brings up so much stuff for us.
And you don't have the energy to even, like, that was my thing. My husband and I, we've been together way too long, like high school, over 20 years. And yeah.
Wow.
We kind of were like, by then it was pretty solid. And, you know, we just said, like, I said, I'll talk to you in like 6 months. Like, I just can't. And he's like, that's cool. I'm here.
Yeah. Like, just bring me water.
Like, we're putting it on. Yeah. He would bring me food in the morning before he left, and water. And like, that's all I need for you to get out. And you're fine. But if it's a newer relationship, like, that's scary to feel like we should be still talking and being lovey-dovey. Like, I didn't care. No. But that's hard, because then there's more responsibility, and I have to keep us happy, and it's a lot.
Yeah. And like, how do we navigate parents and in-laws and siblings? Like, that's a lot
of new stuff. Yeah,
lots of new stuff, and a huge trigger. And that's, you know, kind of what I want to end with is just that. And this is really why I love doing this work, why I love working with, you know, really new families, is because of the hope that comes with having a new baby, right? There's something that's so beautiful and so hopeful about it. And it's such an opportunity to really look at and work on our stuff, right? Like, we all come to parenthood with stuff.
Yeah, yeah. And finding your way through it, and like finding a new way, and getting new tools, and how do I communicate? And like, it's so true. It almost forces you to have to learn new communication tools and new ways to deal with stuff. That's actually really true.
Yeah, yeah. You know, and if there's trauma, if someone's coming into it with trauma that maybe they didn't realize, maybe they do realize, right? It's such an opportunity to like get into that and come out of it feeling stronger. And like, it really is this, you know, this is cheesy, but like, it really is kind of a rebirth. It's sort of an opportunity for a lot of renewal and rebirth. And I think there's something just so beautiful and hopeful about that.
Yeah. No, I totally think so.
Yeah.
Yay. Oh, thank you for much. I just think that's so great. I do. And I just always think it's important for people to realize all those things, because they might not have, you know, I don't know, had friends who experienced it or talked about it.
Yeah,
it's mostly when you hear something that resonates, and like, oh, I didn't. And it's, well, my example is always the breastfeeding. Oh, I didn't know I had to just suffer through it. Like, no, it's not supposed to be this hard. It's okay to ask for help. It's okay to need, you know, not know what you're doing. It's all these things.
Yeah. We all need help in this.
We all need help with everyone.
With everything.
With everything, with parenting. Like, there's so much new. Why wouldn't this be a time where you get extra help or deserve? Yeah, I think it's true. Thank you. So I can post on this link if people wanted to get in touch with you. Mm-hmm. That would be okay.
Definitely go post on the link. Yeah, it's mamacarehealth.ca is my website, where you can find more information, and you can reach out to me directly if you have questions. I would love to hear from anyone that has any comments or anything to share from.
Sure. Just, that would be amazing. Okay. Mm-hmm. Thank you.
Thank you, Angela.